Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios. Every 40 seconds, someone has a stroke, and with a stroke, time matters most for both treatment and recovery. And joining us to talk about stroke rehabilitation is Dr. Lucinda Adriana Arenas, a physical medicine and rehabilitation physician at Baptist Health South Florida. Adriana, Lucinda, we'll call you Adriana. Thank you so much for being here.
No, it is my pleasure. Thanks for having me.
Now let's start a show with a little history. In 400 BC, the Greek philosopher Hippocrates described the stroke phenomenon as sudden paralysis. So, doctor, what is the goal of stroke rehabilitation when someone feels this way and someone is recovering from something so massive?
So, Kathy, let me first explain what is my specialty. So, physical medicine and rehabilitation is a medical specialty dedicated to care and treat disability after injury or disease resulting from bones, muscles, nervous system, meaning brain and spine. Right. The rehabilitation doctor, like myself, we also are called physiatrists. We might lead a team of other disciplines and health professionals like therapy to care for the whole person, to treat pain, to restore function, and most important of all, to improve quality of life. And this improvement in quality of life should actually be the foundation of any rehabilitation program. Specifically in stroke patients, we as physiatrists can offer huge approach in the treatment of a whole person.
Right.
So it's very important for us to be able to be involved very early in the process after the patient is being treated.
And that quality of life is and should be the end goal as always. Do you only see stroke patients or you see other types of patients as well?
No, as a matter of fact, physiatrists see lots of neurological conditions other than a stroke. We also treat patients with multiple sclerosis, Parkinson's disease, other degenerative neurological disorders like ALS, and also cerebral palsy. We also treat, and other conditions different from neurological disorders that maybe are not pertinent to the program today, but it's really a huge specialty where we get to treat a lot of different conditions.
And today we're talking about strokes, and when having a stroke, seconds matter. The Centers for Disease Control and Prevention shows us why time is so vital. Let's get an inside look at the two types of strokes.
When someone is having a stroke, every minute counts. Just as putting out a fire quickly can stop it from spreading, treating a stroke quickly can reduce damage to the brain. If you learn how to recognize the telltale signs of a stroke, you can act quickly and save a life, maybe even your own. For both men and women, look for these 5 signs of a stroke, all of which come on suddenly. 1. Numbness or weakness in the face, arm, or leg, especially when felt on just one side of the body. 2. Confusion, including trouble speaking or understanding speech. 3. Trouble seeing, from one or both eyes. 4. Trouble walking, or problems with balance or dizziness. 5. Headache, especially a severe one that comes on suddenly. The clock begins ticking as soon as you spot the signs of a stroke, because some treatments can only be used if the patient reaches the hospital in the first 3 hours after symptoms appear. So don't wait. Call 911 right away and get the person to a hospital immediately, even if the symptoms go away. If you think someone is having a stroke, remember the word FAST. F is for face. Ask the person to smile and check whether one side of their face is drooping. A is for arms. Have the person raise both arms and see if one arm drifts downwards. S is for speech. Ask the person to repeat a short phrase and notice if their words sound slurred. And finally, T is for time. If you spot any of these signs, call 911 right away to get the person to a hospital fast. Strokes are medical emergencies. The sooner a patient gets treatment, the better their chance of a good recovery.
FAST, and that's an acronym that we're going to be seeing so frequently now. We're speaking about stroke and rehabilitation, which is face, arm, speech, and time, right? How crucial are those 4 things when it comes to getting into rehab?
Right. So basically, it depends on where the stroke is located. Either if it's a hemorrhagic stroke or ischemic stroke, it depends on the side of the brain that the stroke is going to be located. So basically, this FAST means for face, weakness in the face and weakness in the right arm or leg.
Right.
And some speech problems, speech deficits. Patients probably are not able to speak or understand what they're being told. And this is pretty much when the stroke is located on the left side of the brain, which affects the contralateral side, of course.
Now, according to the Centers for Disease Control and Prevention, almost 90% of strokes are ischemic strokes. So what's an ischemic stroke and how does that happen?
So yeah, so there's basically two types of strokes that we see. One is ischemic and the other one is hemorrhagic. And the difference is ischemic stroke is more like a blood clot that is going to be located in one of the main arteries in the brain. It's going to obstruct the blood flow to the brain to a specific area, causing a specific deficit on the patient. Whereas hemorrhagic stroke is more a bleeding condition in an area, of the brain as well, that can also take the patient to present different symptoms.
Now, a stroke can affect people at any age. So I want to go through some of the risk factors that might make someone more likely for a stroke, because I know some people are more predisposed to having one. So can we talk about these, Adriana? Age and family history are ones you can't change, unfortunately.
Yes, so prevention and education actually on risk factors for patients is very important, because once they have a stroke, there's a possibility that they could have another one later on. So they need to know what the risk factors are and how to take care of them. Probably of all the risk factors, some are related to patient modification that they can really work on, and I will probably mention high cholesterol, high blood pressure, and smoking of what the ones you have on your list are probably the three main risk factors that can potentially take the patient to have a stroke, and they are able to really take care of them if they know how to manage.
These are in our control. These three we can manage with lifestyle changes.
Exactly.
Help prevent the stroke.
Yes.
Now, when you have family history or whether you're male or female, how does that play into risk factor for strokes?
Well, it's also a risk factor, mainly for males. And of course, if you have a strong family history of a stroke, you have more tendency to develop later on a stroke. Later in your life, but of course these are probably more difficult for the patient to manage because they are intrinsic to the patient, so it's a little bit more difficult for them.
Now, does the size of the stroke cause more damage to the brain?
Okay, so the damage to the brain, it depends really on the size of the stroke. Of course, the bigger the size of the stroke, more damage it's going to cause.
Right.
And more deficits the patients are going to have, and probably more difficult is going to be the final outcome and the recovery of the patient.
Now, when you see a patient, obviously the rehabilitation is tailored to what kind of stroke this patient had and at what stage they are?
Well, when we see a patient as physiatrist, so remember, patient has a stroke, he's initially evaluated and treated by neurologists. And once the patient is medically stable, able to speak, able to move, then we come on board as physiatrists to be able to offer, a good rehabilitation approach to the patient. And the first thing that we do as physiatrists, of course, is evaluation of the patient to be able to determine the specific deficits that the patient has. And so that way we kind of know where the stroke happened in the brain, what areas were affected, and that way we can design with the whole team and plan a rehabilitation program for this patient.
When you say the word deficit in describing this with a stroke patient, what does that mean?
So deficit is basically the symptoms that the patients present after the stroke.
Okay.
And these deficits or symptoms are going to be based on the location of the stroke and the areas inside the brain that were affected.
Interesting. So up next, we're going to explain what a TIA or a mini stroke is and the importance of rehab. You're watching the Health Channel, all health, all the time, on South Florida PBS. If you have a question on stroke rehab, please call in using the toll-free number 855-796-4475. And visit our website, allhealthtv.com, where you can watch videos from previous episodes and submit questions for our experts. We'll be right back.
I was too young to get a mammogram, and I had no family history, and the lump was probably just nothing.
And I sat in that waiting room talking to women, and there were about 10 of us, and I casually joked with another woman, I can't believe that 1 in 8 women will be diagnosed in breast cancer. There are 10 of us in this room today.
Yo sabía que iba a regresar positivo.
She was fairly certain that I had breast cancer.
When I heard my grandmother was sick, I knew I had to take care of her more.
I heard the 3 most horrific words anybody could ever hear. You have cancer.
They were giving me life-changing, devastating news, but at the same time, they were giving me a plan.
I felt very blessed to be here in Miami and to have a network of doctors.
Cancer treatment is ugly. The way Baptist treats you as a person is beautiful.
I just knew in my gut that I was going to be okay.
When you finish radiation, you ring a bell. Pretty much the entire staff of MCI showed up.
Your dream team is out there.
Las siento como unas personas como amigas, más que doctores.
If I waited, I wouldn't be here today. Early detection is incredibly important. Know your body. Go into your doctor, get the mammogram, get checked.
I can't stress enough how important it is to be your own advocate.
Early detection saved my life.
So many people helped me, and now it's my turn to give back.
There's part of myself that I had lost, and I found it after.
Mis experiencias en Miami Cancer Institute han sido muy buenas. Los tratamientos han sido sensacionales.
Miami Cancer Institute is Disney for cancer patients.
Embrace tomorrow.
Programe su mamografía hoy.
Abraza el mañana.
Schedule your mammogram today.
Hello, I'm Dr. Jose Sosa with Baptist Health Primary Care. Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills, severe enough to reduce a person's ability to perform everyday activities. While symptoms of dementia can vary greatly, at least 2 of the following must be significantly impaired to be considered dementia: memory, communication and anguish, ability to pay attention, reasoning and judgment, visual perception. If you feel like you or someone in your family might be experiencing these symptoms, contact your primary care physician so that an evaluation can be performed.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and with us is Dr. Lucinda Adriana Arenas, a physician, physical medicine and rehabilitation physician at Baptist Health South Florida. If you have a question about stroke rehab, please call in using the toll-free number 855-796-4475. Dr. Arenas is here to answer your questions. Now, Doctor, you're standing next to an image of the brain, and using this image, can you please talk to us about the impact of the stroke depending on the area that the brain is involved in?
So when you have a stroke, there's, I will probably say 7 different areas in the brain where a stroke can happen. And depending on these areas, there's going to be specific symptoms and deficits that the patient is going to present. If you see, this is the side of the brain, this is the frontal part or the anterior part where we have the frontal lobe. When the stroke happens in this area, patients are going to present communication problems, mainly expressing their speech. And they're also going to have problems with motor function, behavior, and the center for inhibition is going to be also located in this area. Now, moving a little bit for this side, we have the parietal lobe, which is located behind the frontal lobe. Patients are going to present numbness, like sensation deficits in the arm or the leg that was affected, and also speech deficits, but it's more the inability to understand what they're being told.
And that's when you see the patients that certain parts, either the left side or the right side, they lose sensation, they go numb.
So it also depends on the side of the brain. Remember, it can be the left side or the right side. So if it's the left side that was affected, they're going to have on the other side weakness in the arm, in the leg, speech problems, and facial weakness, or what we call droop. If it's more on the right side, the stroke, they're going to have on the left side the weakness in the arm and the leg, and they're going to present also what we call neglect syndrome. This neglect syndrome is basically when they denied the left side of their body and everything that is on the left side of their visual campus. So in this area, we have the temporal lobe. And in the inner aspect of the temporal bone, we have a big system that is in charge of the emotions, the initiation, and the part of the behavior as well, and that's going to be affected. Moving to the back part of the brain, we're going to have the occipital lobes, which are in charge basically of the vision part. So patients who have problems in this occipital lobe, they're going to present problems with vision. And lower, we have the cerebellum, which is this little structure here. Patients, when have a cerebellar stroke, they're going to present and have problems with coordination, movement, and equilibrium, and also speech. But this speech is going to be different, something that we call dysarthria, and is basically a slurred speech or disarticulation.
Dr. Adriana, as a question for you, of the 7 areas of the brain, which is the most common that you mostly see and affected by a stroke?
Yeah, probably the most common that we see is the frontal area, affecting frontal and parietal lobes are probably going to be the most frequent areas involved.
And to reaffirm what you said before, if affected in that frontal area, what are some of the symptoms we're going to see of a patient who is having a stroke in this area?
So the symptoms that we're going to see are going to be aphasia, or inability for the patient to understand what they're being told, and or inability for the patient to express verbally their thoughts. They're going to present with weakness and numbness in one arm or the leg. And they can present also some behavioral problems if it's on the frontal part of the lobe.
Now, does knowing what area of the brain is affected give you an indication as to how the course of rehab is going to go?
It is actually, because once we know, we examine the patient, we determine the deficits, we kind of have a big idea of where in the brain was the injury, and then we can design a program and plan a rehabilitation approach to help the patient with their deficits.
And the intensity of that program, again, dependent on where in the brain?
Yes, the intensity of the program is going to be based on how intense, how severe, how big was the stroke. So remember, for recovery especially, there's different factors that will affect this. And it can be the location of the stroke, the size of the stroke, the parts in the brain that were affected. And then the recovery can take longer based on, all this.
This is so informative and so helpful, especially when you have a visual here. And I want to reaffirm again, Dr. Adriana, if you can just, again, before we move on, when the stroke affects the right side of the brain, what are we seeing? And when it affects the left side of the brain, what do we see?
Sure. So when the stroke affects the right side of the brain, we're going to have symptoms on the contralateral side. So meaning on the left side, the patient is going to present with arm and leg weakness and numbness. And they're going to have neglect syndrome, what we call like that, and a patient is going to basically ignore their left side of the body. Okay. That's the main deficit. When they have a stroke affecting the left side of the brain, then they're going to present all the symptoms on the right side, meaning arm and leg weakness and numbness, of course facial weakness as well, and speech deficits, what we call aphasia, meaning they have inability to express their language or inability to understand what they're being told.
Thank you, Dr. Arenas, for that. Now, we don't get many second chances with a stroke. A TIA, or transient ischemic stroke, is a mini stroke, and symptoms usually go away within 24 hours and you feel fine again. But if you go into a stroke center or a hospital fast, you risk a full-fledged stroke, and that can change your life forever. Let's take a look.
You were smart to come in right away.
I almost didn't come in. Just imagine if I'd waited.
Got any questions?
Steve, are you okay?
My hand just went numb, but I'll be okay. Let's keep going.
It could be a stroke. You need to get to the hospital now.
It's fine now, really.
Oh no, Steve, you need to get to the hospital. If it's nothing, I'll buy you lunch.
Earlier today, Steve had a transient ischemic attack, or TIA. TIAs are mini strokes, often leading to a stroke at a later time. There is a simple stroke and TIA test called FAST. Face, does your face droop? Arm, does your raised arm drift downward? Speech, is your speech slurred? Time, if anyone exhibits these symptoms, don't waste time. Taking fast action can mean a second chance at life. Don't let a TIA get the best of you. Call 911 or get to the nearest hospital fast.
That is so scary, but so common too, that sometimes you have a stroke and you may not even know you had a stroke. Is this true?
Yes, that is true. And actually, then we talk about the mini strokes or the TIAs, which are pretty much transient strokes, very small strokes that can cause very small deficits on patients that they might not even notice that something is happening to them. Probably they just feel tired. They feel something is going on, something is weird. They don't feel like, like they usually feel, but they don't really know what is going on. And then all of a sudden they can feel again fine, but this could be just the initiation or the first phase of a big and massive stroke that they could have later on.
Now, is there a window of recovery right after a stroke that's so crucial?
Right. So, Kathy, that's a very important question. Yes, there is a window for recovery. So once patients have a stroke, we say that during the first 3 to 6 months.
3 to 6 months.
That's the ideal time for recovery. And this is the time where we need to take advantage of all the resources that we have with therapy and all the rehab approach to work with this patient very intensively so we can help him. We see that even up to 50% of the recovery can take place during these months. Now, what happens after that time? The patient is still going to continue recovering, but probably it's going to be slower. And at the end of the first year, they can reach a phase that is called a plateau, where patients seem not to be improving anymore. This could last for a couple of weeks and even months. And beyond the first year, we're still going to see improvement. Even 2-3 years after the stroke, we still can see improvement, but it's going to be much slower.
Okay, but this is normal, this plateau you speak of. Is this happens with most patients?
Usually most patients, this is what they show, yes.
Now, after emergency treatment, stroke care focuses on helping a patient recover as much function as possible and return to independent living, because that's the end goal. And the American Heart Association put together a short premiere on how to get the most out of rehab. Let's watch.
With stroke recovery, it's important for patients and family members to have a good outlook. The message that the American Heart Association is promoting is that strokes are preventable, treatable, and beatable.
The person with the stroke is going through a very frightening change in their lives and in their bodies, and helping that person cope with that change is important, just at an emotional level.
Patients will be referred to either acute rehab, subacute rehab, or a skilled nursing facility.
There's a big part that the person can choose to do about recovering from their stroke. Participating in formal therapies with like physical therapists or occupational therapists or speech language pathologists.
The most important thing is to get the person reintegrated into society.
There's tons of stroke survivors who are out there banging away at their jobs, at raising their kids, at being a spouse, a church volunteer, a member of their community, who are living very full lives.
that support from family and friends is such a huge part of the recovery, wouldn't you say, Dr. Arenas?
Yes, it is. It is. It's very important. And as a matter of fact, as physiatrists, when we evaluate the patients, we have them in the rehabilitation unit. We meet with family and friends. Caregivers, most of the time caregivers are family members. It's very important. So remember, this is a very overwhelming situation for patients and families. It's very stressful, brings lots of anxiety and frustration. So the more they know about their condition and their deficits, this is part of the education that we also give, and the more training that we can provide them, with all the therapy disciplines, the better the outcome, because they're gonna feel more comfortable and more confident once they go home and they start, facing their real life and the day-by-day activities that they have to do.
But even in the hospital, this is really a team approach in caring for a stroke patient. I mean, we have a graphic here of all the individuals it takes to get this journey back on track, and it really takes a village. Can you talk to us a little bit about all these team members?
Sure. So it's a really team approach. So what we do is initially we're gonna evaluate the patient once in the acute rehab unit. Everybody, as we have in the graphic, we're gonna meet, we're gonna determine the deficits that the patient has, and we're gonna come up with a plan in the rehab unit. Patient is gonna be able to get intensive rehabilitation every day, twice a day, 6 days a week for a couple of weeks. We have the nursing staff, everybody well prepared to be able to take care of these patients. The nutritionist is very important, of course. All the therapy disciplines, recreational therapies actually is very important for the community reentry skills. Social worker, case manager, and psychologists or psychiatrists also, of course, to help us with the emotions, and all the anxiety that the patient might have.
And all these play such an important role. So having all these people, this is part of every process, correct?
This is basically part of every process once the patient goes to rehab, yes. Wow. And then once the patient goes home, they're still going to continue doing rehab program, but it's going to be less intense, more as an outpatient. But they're still going to need, help from the different disciplines based on their deficits.
Can you give me a little insight as to that therapy that patients do receive once they leave the hospital and they go home? Because as you mentioned, it continues afterwards, but maybe not as intensely.
Right. So once patients go home, usually they get therapy 3 times per week for a couple of weeks, and this is based on periodic follow-ups that they should have with their physician or their physiatrist to determine if they're going to need only physical therapy, also speech therapy or occupational therapy, neuropsychology, if they need still to be on board for the patient. So it's going to be an evaluation, an extension of the therapy as long as the patient is going to need it.
It must be so frustrating for a patient whose speech and language is affected, they can't communicate well. How does speech therapy help patients?
So when we have speech deficits in the patients, we try to involve a speech therapy and a neuropsychologist as well. Because when they have speech difficulties, this brings lots of frustration, as you mentioned, to the patient, sadness, depression, anxiety, sometimes even sleep problems. All this is going to impact the recovery of the patient, and maybe they're not going to be able to perform in a good way with the therapy. So this is going to delay their outcome. So we need to involve not only speech therapy, but also neuropsychology to be able to work with the patient, give some cognitive rehabilitation. Sometimes patients need medications also to treat anxiety or to treat depression, so we can improve this area.
So much more that we're going to get to, but coming up, how much of an effect does stroke rehabilitation have on a patient's recovery? We will find out so much more when we come back with Dr. Arenas. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question for our expert, please call in using the toll-free number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch videos from previous episodes or submit questions for the experts. We'll be right back.
Thanks, Coach. Thanks for teaching me about teamwork and leadership.
Thanks for showing me that sports help me stay healthy and do well in school. And thank you for teaching me about concussion.
Letting me know that I should tell you if I think I have a concussion. And how to protect my head and brain. Because one day, I want to be a teacher, an astronaut, scientist, or a coach, just like you. Thank you for protecting my future.
There are some migraines that it looks like the nerves coming out of either the forehead or the back of the head gets caught or under pressure for some reason. We have identified that if you treat the compression, you can treat the migraine. So for us, it's very important. Patient selection is probably the most important thing on our end. Botox, because it relaxes the muscles around the nerves, seems to be a good bellwether of people who will respond to surgery. The best test is then to give a numbing medicine, an anesthetic block to those nerves while they have a headache. And if the headache goes away, then you have very good evidence that this is a nerve that can be treated. People who come in and say, you know, my headache always starts, you know, right above my left eye and it comes across my scalp and it's this throbbing sensation and it always starts the same way. Happens to me multiple times a week, and then if you go and you numb that nerve up and the headache goes away, then you have very good evidence that this is a person who would probably benefit from surgery.
Hurricane Florence made a direct hit on the Carolinas, causing wind damage and widespread flooding. As the floodwaters begin to recede, all state mobile claim centers are canvassing the Carolinas to assist people affected by the storm.
We have mobile claim centers set up throughout the entire area so that people can come to us and they can start the paperwork. And in some cases, if they have a covered loss, we can cut them a check on the spot or deposit money into their accounts.
Learn more at allstate.com/recovery.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. Joining us is Dr. Lucinda Adriana Arenas, a physical medicine and rehabilitation physician at Baptist Health, South Florida. If you have a question for Dr. Arenas on stroke rehab, please call in using the toll-free number, 855-796-4475. You still got time. Now, every year, it is the CDC's goal to reduce heart attacks and strokes. And they talked to a patient who shares his stroke care journey, and I want to share it with you. Let's take a look.
My name is Jose, and I'm 55 years old. I had a stroke about 9 years ago. In my family, the strokes occurred mostly on my father's side. My father had a stroke, his sister had a stroke, and then I had a stroke, all within weeks of each other. I just started feeling like somebody was going around my body, turning systems off. I had a tingling sensation on my leg, and it couldn't move anymore. I had a tingling sensation on my arm, and all of a sudden, my arm couldn't move anymore. And then I just passed out. Over the next couple of days, I really couldn't talk much at all. I couldn't move either arm. I couldn't move either leg. You know, eventually, I got control of one side of my body, my left side, but I still wasn't able to talk much at all. When I transitioned to my house, I was still in a wheelchair. Myself, you know, my wife, my children, my mother, and my friends, we all chipped in and developed a plan where I would be receiving therapy in one way or the other for about 5 or 6 hours a day. And that was when I started to see faster results. I was gradually able to learn how to walk again. My arms started being able to move again. I could start to speak more fluently.
Wow, just hearing him describe, saying it felt like something was going inside him and all systems were shutting down. And in Jose's case, the amount of therapy, he increased the amount of therapy, and that's when he saw improved results. Now, when it comes to therapy, does the time equal better results?
Yes, so actually the time is crucial, but also there's a theory, very interesting theory behind this, and it's called neuroplasticity. Okay. This is a theory for recovery. So neuroplasticity is the mechanism the brain has to rewire itself after an injury or a disease. And then once you take all these new neurons that are forming every day, and the new neurons or brain cells, they make new connections as well.
Okay.
And these new connections get stronger and stronger as more as you do or perform a task. So the more you do, the better it gets, because every time you perform an exercise, you are strengthening all those connections, new connections in the brain.
So in his case, of course, it helps.
Right. In his case, absolutely. That's what it shows.
Now, I want to ask you this. How soon after you have a stroke does rehab begin? Or can it begin?
The sooner the better, you know. So we see patients usually probably like days, just few days after the stroke, and right away we start with the whole team to work. Yes, the sooner the better for the recovery of the patient.
Now there's something called spasticity. What is spasticity?
So spasticity is actually a huge topic in rehabilitation, and specifically in stroke patients it is.
Why?
So spasticity is a condition that presents a few days or weeks after the stroke. What happens is, you know, all those connections between the brain and the centers to relax the muscles are gonna be injured. And then spasticity is basically when the muscles in the arm or the leg that were affected start getting a lot of stiffness. They become very, very, very hard, and they can change the position of a joint.
Oh, wow.
And if we don't treat spasticity aggressively and very early, we can see potential complications such as joint contractures. The contractures is a contracture is a lack of elasticity or flexibility in a joint, muscle, bone, or even the skin.
And Dr. Arenas, what is the best way to manage this condition so it doesn't worsen?
Right, so once we detect the spasticity in the patient, there's basically 3 ways that we have to treat this. So the first one is, of course, physical therapy. So we deal with the physical therapies. They do an excellent job, you know, trying to relax those muscles with a lot of range of motion and stretching of the joints. Then we can use something that is called a splint or a brace. It's a hard device, usually made of metal or plastic, that is going to give support to the joint, and it's going to prevent more contracture and more deformity of the joint. And then we have medications. Medications by mouth, such as muscle relaxants. We have different names, you know, for depending on the side effects and if it's indicated or not for a specific patient based on their overall health and the other medications that they might be taking.
And that's to help the patient deal with the pain?
With the pain not only, but also with the spasticity, to help those muscles to be more relaxed and decrease the tightness and the stiffness in the muscles so they can have better movement of the extremity. And then we have the injectables, and we use Botox actually for spasticity treatment. So it's a medication. Botox is a medication that has a lot of applications in medicine. And one of the applications for Botox is spasticity management. So we inject big amounts of this medication into the bones, into the muscles, that are very tight and very stiff to try to relax those muscles.
How does a therapist help a stroke survivor relearn the basic skills? Everything from walking, from eating, from speaking. How do they do that?
So here, apart from the physical therapy, other discipline that is going to be very helpful with patients is occupational therapy. Occupational therapies, they deal with what we call ADLs, or activities of daily living. And then you have all that is grooming, eating, bathing.
Getting dressed.
Getting dressed, exactly. And even the transfers are very important. When patients transfer from the bed to the chair, from the chair to the toilet, that's something that they need to learn, because we see a lot of falls actually during that period. So occupational therapists work with these patients, training them for their ADLs and their transfers. So the safety is better for them.
To get that strength and function
as well. Exactly. And they train the family members, the caregivers, to also manage all this.
Before we wrap up and go to break, I do want to ask you about patients having bladder or bowel problems. This is very normal.
Yes. So problems with bladder and bowel are common in stroke patients, again, because all those centers might be affected. And this might lead to either leaks or retention. This is not only embarrassing for the patient, but also puts the patient on risk to develop pressure sores and skin problems because of the humidity and the maceration, in those areas. So we need to also treat this sometimes with medications for bladder, either retention or incontinence. For bowel problems, they need to be involved in a bowel program as well, with laxatives or sometimes suppositories, medications by mouth, stool softeners as well. And of course, therapy is also part to retrain those pelvic muscles and strengthen them again.
Absolutely. Then when we return, we'll have more on rehab after a stroke, and we'll look at the latest in stroke recovery care. So stay tuned. You're watching the Health Channel. All health, all the time, on South Florida PBS. If you have a question for Dr. Arenas, why not call in? Use the number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch videos from previous episodes. We'll be right back.
Dementia is not a specific disease. It's an overall term that describes a wide range of symptoms associated with a decline in memory or other thinking skills, severe enough to reduce a person's ability to perform everyday activities. While symptoms of dementia can vary greatly, at least two of the following must be significantly impaired to be considered dementia: memory, communication and anguish, ability to pay attention, reasoning and judgment, visual perception. If you feel like you or someone in your family might be experiencing these symptoms, contact your primary care physician so that an evaluation can be performed.
Hi, this is Terry Bradshaw here to remind you that rheumatic diseases like rheumatoid arthritis and lupus are important to know about. 1 in 4 Americans has a rheumatic disease, and I'm one of them. And if you're like me, folks, you don't have time for arthritis to slow you down. Between being a sportscaster, making movies, and checking things off my honey-do list, I'm busier now than I've ever been. Flare-ups aren't fun, which is why I follow the orders of my rheumatologist. Eating healthy, staying active, not smoking, taking my meds, and managing my stress all keep me going. I've also committed to my health by taking the American College of Rheumatology's pledge to live well with rheumatic disease, and you should too. Know the signs, get help, and take care of yourself, folks. Visit simpletask.org to take the pledge to live well.
cancer. We don't want to think about it, but I had to. Because you see, I was traveling, I was enjoying life, I was working. It was too long since my last PAP. When I was finally tested, we thought I might have cervical cancer. After worrying, no cancer. I was lucky. Women, please get a Pap test to check for cervical cancer and get the inside knowledge about gynecologic cancers for you and the people who care about you.
Did you know that people born from 1945 through 1965 have the highest rates of hepatitis C, but most don't know they're infected? People can live for decades without symptoms, but over time, hepatitis C can cause serious health problems. If you were born during these years, the CDC now recommends that you get a blood test for hepatitis C. So talk to your doctor and find out if you have hepatitis C. It could save your life. No more.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. We're winding down the hour with Dr. Lucinda Adriana Arenas, a physical medicine and rehabilitation physician at Baptist Health, South Florida. Now, you have a question for Dr. Arenas on rehab after a stroke, please call in using the toll-free number, 855-796-4475. You still got time. Now, today we've been talking about stroke rehabilitation. Now, how is stroke recovery evolving? I feel like this is a field that we're seeing so many more technological advances, more resources for patients when they go somewhere like your office, let's say.
Yes, so we get sometimes questions from patients and families regarding new technologies for recovery. And there is the stem cell therapy, which is an invasive procedure. I don't perform as physiatrist. This is more pertinent to the neurology and the neurosurgery areas. But a stem cell is a relatively new procedure that is done locally inside the brain, done very early in the stages after the stroke. And there's just few human studies that show its safety and its efficacy, mainly on activities of daily living more than on motor function. But it has behind the theory of the neurogenesis, synapses, and substitution, where from the stem cell, new brain cells are gonna form. They form new connections, and then there's this new healthy tissue that is gonna substitute the damaged brain tissue, and it's gonna take over the functions that were taken before by this tissue that was already affected by the stroke.
That is incredible.
So it's a complex procedure, you know, still a lot of studies, but that's something that is been going on, yes.
Any other tools or advances that you can speak about?
Not really. I mean, we work with physical therapy, occupational, recreational therapy, but there's no really like a new advanced technology so far that we can offer different from patients.
They say computer games. Do they help, or video games, they help?
Pretty much for speech therapy, especially, and neuropsychology, when they train patients on cognitive rehabilitation. Yes, this is very important for them to do the computer activities.
Now, it's important to keep in mind, while there are better treatment options today, the best option is prevention. So let's take a look at what two Baptist Health South Florida doctors have to say about prevention.
A stroke is not like a heart attack. A heart attack patients have tremendous pain in their chest, and therefore they seek immediate help. For stroke, they have weakness on one side, they can't speak. So must be patients have to be able to recognize this type of problem, and there's a very quick way to do it. Now, if there's FACE, this FAST acronym, F is for face, arm, speech, and T is for time. So when a patient an individual develop immediately face weakness, arm weakness, or leg weakness, can't speak, then you really have to call immediately. Time is the last. Is a T on FAST. You call 911 and bring the patient as fast as possible to the comprehensive stroke center. We're highly experienced. We can perform a procedure in 15-20 minutes at the most. So we're very fast. And the reason why we're fast is because the brain dies very fast. So the fastest we unblock the artery, remove the clot that blocks the artery, the better is the outcome for the patient.
Nowadays, we perform procedures that we basically are aimed to go there and remove like blood clots from the inside the vessels in the brain and basically restoring the blood flow. And those are things that were not possible like a few years ago. And now it's something that we do like routinely, and that really impacts the lives of the patients very well. Stroke is a major cause of disability. You know, it's also like the 5th cause of death in the United States. You know, basically the prevention for acute stroke is very similar to the prevention of like cardiovascular health in general. So make sure you exercise, make sure you eat well, make sure your diabetes or high blood pressure are under control, make sure your cholesterol is under control, and again, don't smoke. That's one of the most important things.
Well, we saw Dr. Linfante and Dr. Dabus there who've been on the show, and we love them very much. And something they say, prevention. How much does eating well, exercising all play into this?
Of course, so prevention is very important. And we also, as physiatrists, not only treat, as I said before, but also we do a lot of prevention of potential complications and educate patients and families on prevention, on risk factors as well, including exercise and diet and other risk factors.
Dr. Arenas, what long-term exercises do you recommend? Because that's something that they mentioned in the video and part of the healing process.
So once the patient is out of the initial period of rehabilitation and they're ready to start like their own exercise program, there's a couple of recommendations that we give. So one is you need to start slowly and as tolerated, of course, the exercise. You need to try to do 30 minutes per day, ideally every day during the week.
30 minutes every day.
And you can start with a moderate aerobic exercise for endurance, and that means walking, dancing, and swimming. Is ideal. You can do for the strengthening, you can do some low weights, 5-10 pounds. And for balance, you can also try Tai Chi, or you can also try aquatic therapy. Just even walking inside the pool is going to be very good for them.
Huge, right? Walking in the pool is a lot of work.
It's a lot of work. Yes, it's
now,
a lot of work.
One of the things I think it's important to touch upon again before we wrap up the show is that importance of educating family caregivers. So how do you speak and educate family members, friends, caregivers who have a stroke recovery patient at home?
Right. So we usually meet either in private or sometimes with the whole team. We bring the caregiver, who's usually a close family member, and also the patient, of course, to try to explain them as clear and as much as possible about their condition, about what happened, about what can happen in the future, why the symptoms or the deficits that they have, and how pretty much is going to be the recovery. We try to explain to them realistic goals, short and long term as well. So they understand and they can cooperate better with the rehabilitation process.
Now, how do patients who have strokes prevent other strokes from happening?
Right. So this is basically, you know, risk factor prevention.
Risk factor
prevention. That's what we always tell them. If you know that you have high blood pressure, if you know that you need a specific diet, if you have high cholesterol, you need to take your medication, you need to visit regularly your primary care physician for this, because it can happen again, it can be bigger, and it can have more impact on your, you know, quality of life.
Dr. Adriana, so impactful. Thank you so much for being here.
Thanks for having me.
That was amazing.
It was a pleasure.
That does it for us at this hour. So be sure to join us next time on the Health Channel, All Health All the Time, on South Florida PBS. Follow us on Twitter, Facebook, Instagram at All Health TV, hashtag All Health TV, where you can get health tips from our experts and see what's coming up on the Health Channel. You can also visit our website, allhealthtv.com, to watch videos from previous episodes or submit questions for the experts. There's so much on there. I'm Kathy Buccio. We'll see you next time.